People have joined, so we will go ahead and get started. Well, welcome everyone. My name is Laura Santuri. I am the chair of the board of directors for the Interstitial Cystitis Association, and it's my pleasure to welcome you to the third webinar in the ICA's new speaker series, Navigating ICBPS, Conversations with Experts. Today's webinar will feature Dr. Tony Buffington presenting Uncovering Social Factors in Chronic Primary Pain Conditions, Lessons from Our Feline Companions. We're really excited to have you here today, and it's a special privilege to be able to introduce Dr. Buffington to you. He has been a mentor, a friend, and a colleague for a very long time, and someone who has been an ally to this community, both humans and cats, for a really long time. So I'm really pleased for him to be speaking with us today. Just a few housekeeping items before we get started and I turn things over to Dr. Buffington. Please note that this session will be recorded, so you don't have to frantically take notes. We will have a recording for you. To ask a general medical question or something related to Dr. Buffington's presentation, please use the raise hand feature in Zoom. You'll be asked to unmute yourself at the end. And please stay muted while you're not speaking just to avoid background noise. You can also ask a question using the chat feature. You can just jump in and post a question as they come to you, and we'll take a look at those at the end of Tony's presentation. Dr. Buffington will answer as many questions as he can in this webinar, and just prepare your questions as soon as they come to your mind, put them in the chat or write them down so we're ready to have our Q&A session when he's done. So without further ado, I'm going to turn things over to Dr. Buffington.
All right, well, okay, I guess I'm on. Good morning, everybody. And thank you, Laura, for that lovely introduction. And I'm trying to be a little festive today because this morning is the summer solstice. So the first day of summer. So it's a nice day and I'm glad everyone has come. Let me share my screen and we will get started. Voila. Okay, good. So, excuse me. My topic today is social factors in chronic primary pain conditions, lessons from our feline companions. And the social factors are known but not talked about so much in interstitial cystitis and chronic primary pain conditions. And if you're not familiar with that term, it's a relatively new one. A classification implemented by the International Association for the Study of Pain in 2019, but it's really sort of a synonym with chronic overlapping pain conditions. And we'll talk about a little bit about what those are. I will generally use the term IC this morning because everybody will know what I mean. And because there's now about 14 different names for interstitial cystitis, and unfortunately, none of them have led to better outcomes for patients. I'm also a little concerned about naming diseases for an organ until you truly understand what's going on, because just do this. Anyway, sorry. There we go. And the reason for that is in my experience, it focuses more on the organ than on the whole individual. And that's true for a number of chronic overlapping pain conditions, irritable bowel syndrome, endometriosis, for example, talk about the organ, and it overemphasizes research interest in the organ as opposed to looking at it in the context of the entire individual and their context, which is where social factors come in. Anyway, we will talk about those things as we go along. Start changing. There we go. So just by introduction, I've been a veterinary clinical scientist for a long time and spent almost my entire career on research and clinical experience with interstitial cystitis in domestic cats. And in addition to that, I've also done research studies with people, with research colleagues on people with interstitial cystitis fibromyalgia and irritable bowel syndrome. So I've been around these chronic overlapping pain conditions for most of my career. I have no conflicts, financial or ethical, to disclose. And I'm going to try to talk with you today like I'm your crazy old veterinary scientist uncle. I'm not a physician, obviously, and so I'm not going to make too many make recommendations about those things. But I'm going to just try to say, if one of my family members came to me and said, "I have IC, what do I do?" how I would try to help them. So here's my disclaimer. You can read that if you want. I also don't plan to talk much about drugs for IC, for just the reason that I don't have a lot of experience with them, clearly not people anyway, and because based on my understanding and reading of the literature, when most of the drugs that are used for IC are studied using properly designed, prospective, double-blind, placebo-controlled, randomized controlled trials, they don't seem to be generally effective. One of the curious things about IC and other chronic overlapping pain conditions is that it seems like everything works for somebody, but nothing works for everybody. And there's probably something important there that we're missing, but time will tell. So my plan for the day is I'm going to give you a brief introduction, sort of define what the chronic overlapping pain conditions are and what I mean by social factors, spend some time talking about what we learned in cats that we studied for about 25 years, and then how I think this might help people with IC, realizing that cats and people are very similar in some ways and completely different in other ways. And then finish up with how I would approach it with a family member, and to maybe give you and your quote family, whether they're related to you or not, some ideas that might help you cope better with this situation. Okay, so here is a list of chronic overlapping pain conditions, the 10 most common ones, and how many people they're thought to affect. And these numbers are just estimates. It also depends on what the diagnostic criteria is that are used. And so they're really, as far as I can tell, just kind of ballpark figures. But see the list here, they range from chronic fatigue syndrome, which maybe affects 4 million, down to irritable bowel syndrome, which might affect as many as 44 million. ICs here estimated to be around 8 million. But as I said, these are all just estimates. But if you add all these numbers up, this is 140 million people. So there are a lot of folks that are suffering with these conditions. And the other aspect of it that makes it complicated to understand and study is that there's sort of 3 dimensions of these conditions. There's the intensity, how bad it hurts. There's distress, and how it affects one in terms of worry and anger and sadness, irritability, all of those kinds of things. And then there's interference. And so how does it interfere with your daily life, and for our purposes here, your social life? So there's a lot of different ways to think about these diseases that I think make it more complicated to study and to understand. And what is, I think, underappreciated, at least was by me, and is suggested that suggested in the literature that it is as well, is that humans are the ultra social mammal. And I sort of like this term because cats are the ultra carnivore mammal, and so they literally need to eat other animals to survive. And being ultra social means that we need to be with other animals to survive. And that's how we got through evolution, because we're, you know, these kind of scrawny little naked things running around in the forest. But we have social, once we decided that we could connect with each other, then we got connection, validation, and intimacy all came together, because what we needed to survive was to be able to forage, and we couldn't find enough food on our own. We needed to protect ourselves from predators, which larger predators we couldn't do on our own. And we needed to protect ourselves from other people, and groups were a better way to do that. And so we really survived evolution because we could cooperate and work together. Working against all that are social injuries, which you can think about. Things like, and these, sorry, I should be pointing out. So this is what we need over here. Okay, there we go. And over on the other side, 4, 5, and 6 are the kinds of social injuries. So conflict with others at work or at home, invalidation by caregivers, exclusion from social groups, and loneliness, which we'll talk a little bit more about loneliness later. And one of the things I like about this figure is it sort of reduces it into how it affects the body. And so I'll talk about this a little bit more later, but most of the information from inside our body and outside our body comes in through the bottom of our brain and then percolates up into the rest, up into the rest of the brain, and then comes back out. And you can see here the major factors that bring information out from the brain to the rest of the body are the sympathetic nervous system here. This HPA stands for hypothalamic pituitary adrenal axis. And then this is the vagus nerve, which is one of the longest nerves in the body. And what happens is that down here, these play out by releasing molecules like catecholamines, cortisol, pro-inflammatory cytokines. I mean, this is a whole alphabet soup that we won't get into deeply, but I just want to use this diagram to make the point that the brain and the body and the mind have to be thought of as one unit. I mean, as scientists, we kind of dissect them out because they're just too complex to study in their whole, although that's improving too. But it's the system isn't in pieces. Our study of the system is in pieces, and so this is all irreparably connected to each other. And I'll use some of these terms again. So I just wanted to give you a little overview picture of where this was going on. Okay, so what did we learn from cats? Just to, first of all, let me introduce you to the woman in this picture. This is Judy Stella, who worked with me at Ohio State when I was there. Judy came to me as an unregistered veterinary technician in 2006 and left in 2011, with a PhD in applied animal behavior. She is the best observer of animals I have ever met, and I grew up on a cattle ranch and have been around animals literally my entire life. And she always saw things that I didn't see. She's just an extraordinary person, and also, as you will see, a very hard worker. But anyway, we got an NIH grant in 1993 to study cats as a possible naturally occurring model of interstitial cystitis in people. And just to jump to the end, they are. They're acknowledged by NIH as the only naturally occurring model of people. But they're not used much anymore and for reasons that we can talk about if we want to. Anyway, what happened was that with this funding, I'd go to meetings and talk to veterinarians about IC in cats and say that if you have a client that has a cat that they're going to euthanize for IC because they're no longer an acceptable pet, and they might be interested in it, they could donate the cat to our research program. And the deal we made with the owners is that we would treat those cats like they were our patients until the end of the study, and then we would euthanize them. So the outcome, unfortunately for those cats, wasn't any different. And at the end of the study, the control cats were adopted out to students and others around the vet school. We housed them in a colony at the vet school at Ohio State, and did a whole lot of studies on them that if you just go to PubMed and type in Buffington cats, you'll be able to probably spend more time than you'd want reading them. And then, as I said, they were euthanized or adopted. Let's see, is there something I missed there? No. So that's sort of what we did. And what did we get? Well, we got, as you can see here, cats of both sexes, from kittens to 15-year-olds. They tended to be moderately or severely affected, just because of how we're recruiting and how they were donated. But what's true in cats and people is that the symptomology on all those three intensity, distress, and interference scales that I talked about varies from minimal to severe. And so there are cats that have very minimal disease. They might have one episode of urinary tract problems and then never have another one. So these were and so this wasn't maybe as representative of the whole class, but it was easier. The more severely affected ones, it was easier for us to see the differences. So worked out. They also were heavy record cases, and that's just slang that means there's a lot wrong with these animals. They had a whole variety of other health problems associated with their GI tract and their skin and their behavior, excuse me, that had been diagnosed. And IC was usually the last thing to be diagnosed. We found that they would have flares in some of these other health problems after changes in the colony, but generally not urinary problems, and maybe just because the threat wasn't bad enough. We also learned, it's also known that glomerulations are not the same as symptoms. You can see bladder lesions in the absence of symptoms as well as in the presence. And the thing that was most curious to us was that putting them in an enriched colony where they felt safe, loved, and believed, and I'll show you a little bit how Judy did that and how she worked with them, how that could affect the bladder. So we started thinking that, well, maybe there's something going on somewhere else, and not just in the bladder. And that's sort of what we found. So these were some of the things that we looked at. So they had, and this has been found in both humans and cats, by the way, increase in startle responsiveness, and some IC patients will tell you that they just seem a little jumpy, hypervigilant about what's going on around them. This, I showed you the sympathetic nervous system and the parasympathetic nervous system. It seemed like there was more sympathetic drive, which changed, and we don't need to know anything about this. This is just a metric, heart rate variability, but this is all autonomic dysfunction. There's also increased inflammatory cytokines like IL-6 and IL-1, those kinds of things. And we also found that there was decreased adrenocortical restraint, because that HPA axis that I showed you in that figure is generally something that ends the threat response, but it doesn't work. And what's even more confusing is that sometimes you can have high cortisol and it's not working, and sometimes you can have low cortisol and it's not working. But we also found that in cats, and we had evidence that that system had been damaged while they were still inside their mom. So something had happened to their mom. The products of her stress response had crossed the placenta, gotten into the kittens, and sensitized their stress response system. So it was pretty confused. It was pretty confusing at the start. I mean, it makes more sense in retrospect. But anyway, so the summary of all of that was just that these cats and from the data that we have in people have increased central threat response system activity. So what's the central stress response system? Well, it turns out that it is an ancient protector, as it says there. The stress response in the old brain down here is 500 million years old. Humans have been around for about 100,000 years. So if you turn years into seconds, the threat response system has been around for 16 years, and people have been around since yesterday. So it has survived a long time, and so it must have important functions. And it predicts dangers, because if you had to just think about it, when surviving in the wilderness, if you have to get injured before you know that you get the idea that something is wrong, you're going to be food. So that's not going to work out very well. So what happens is that we get signals from inside the body and from outside the body, and the brain tries to understand what those signals mean. And if it decides that, and this is all in quotes, I mean, this is because it all goes on extremely fast, like a 50th of a second. The brain is going to decide whether there's danger there, and if there is, it's going to respond. And it's going to respond in those autonomic, endocrine, and immune systems that I showed you in that previous diagram, to protect the body, to help it recover. And also, it's going to motivate the behavior of running away. And if you can't run away, fight. And if you can't run away and you can't fight, to try to freeze, so that the predator might think that you're already dead and will leave you alone. So that's the short version of the autonomic nervous system. Of this predict, and it's important to understand that this is a prediction system. It doesn't work after the fact. It tries to decide before it gets sensory input what the next sensory input is going to be, so if there's danger coming, it can get out of the way quicker. And so here's another, just another picture. Here's the older brain, the old brain, and the new brain. And I imagine that somebody might be thinking, wait a minute, are you saying it's all in my head? Well, yes, if it is your brain, so most people's brains are. But no, if the person who says it, and I don't in that context, is trying to exclude you or blame you or invalidate you for what's going on, because then it's in their head. And at some level, I would like to see us find a way to respond to people like this by saying, well, yes, my pain's in my head. All pain is in my head, because that's where my brain is. Where's yours? Or something like that. Well, if you figured out where it is, help me get it out. And if you've got better suggestions, I would love to hear them. I would leave the profanity out, if you don't mind, and just stick them in the chat. And maybe we can talk about those a little bit later. Anyway, so now that we understand what the threat response system is and where it is, the next question that we could ask is, well, does it affect the bladder? And the answer is yes. And this is electron microscopy of the surface of a cat bladder. This is normal, and these are cats with IC. And what you can see is that the bladder has these big superficial lining cells here called urothelial cells that are some of the oldest cells in the body. They live for longer than a year. And then if they are stimulated by E. coli or some microbe, they will pop off, envelop the microbe, and be flushed in the urine in seconds. It's extraordinary. It's an extraordinary system. But anyway, you can see how there's a lot of these that have been popped off. You can see the underlying suburothelial tissue there. And we published this in 2000, and we were just so excited because we figured it out. And then the same month, this paper came out. And if you look at these pictures, they look very similar to what we published. And in fact, if we could switch them around, and I don't think anybody could have told the difference, but these pictures were taken of the inside of the bladder of mice who had been left in their colony for 48 hours with the lights on. And if you don't know, mice are nocturnal. They're species that are active at night, and they sleep during the day because they don't like the light. And so if you leave them in the light for too long, that stress of just being in that environment starts doing the same kind of damage that we saw in the icy cats. And of course, similar pictures have been reported for people as well. And the other problem is that just this title is excellent. It says cystoscopic findings of IC, glomerulations and the like, are also seen in normal women undergoing tubal ligation that have no symptoms at all, no bladder pain, and we found the same thing in cats, that there's symptoms were not the same as the bladder lesions that we observed, because we did cystoscopy on cats too, both males and females, which was tricky. So just to give you an overview of the colony, this is time, about 6 months, and then after on the x-axis here, and then this is symptoms. Sickness behavior, you don't need to worry about. We can talk about that later if you want. But those are just observed symptoms that the cats had. And what you can see is that when the cats first came into the IC cats first came into the colony, they had quite a few symptoms, many more than the controls. But after about 6 months in the colony that Judy was in charge of, there wasn't any difference, and they would still have symptoms from time to time, but there wasn't any difference any longer between the IC cats and the healthy cats. So if we look for a little more detail of that, this is a busy slide, but anyway, this is again time on the x-axis, and you notice this is more than 3 years. And so basically what Judy did was went into the colony that had between 20 and 40 cats in it at any one time, both IC and control cats. Excuse me. And she loved and trusted and believed the cats. So she took over a fair bit of their care, cleaning cages, helping to clean cages in the morning, and handle the cats, and then coming in the afternoon and letting the cats play. And one of the interesting things is that she would just open the doors to the cages, and if the cats wanted to get out and play, they could, and if they didn't want to, they didn't have to. So we learned that choice was important. And then at the end and then she would just make behavioral observations of the cats, watch what they did. And some of them played by themselves, and some of them played with each other, and some of them stayed in the cage. And so she knew every cat in the colony personally, which was quite extraordinary. Excuse me. And what you see in this graph here that she recorded during that time, oh, I know what I forgot to say, is that at the end of playtime, she would just clap her hands and say, "Get back in your cages," and the cats would all jump back into the right cage. It was just phenomenal to see. And anyway, what you see here, so this is more than 3 years of twice a day, every day observations almost, and I'll show you the difference. And this is now just a percent of cats that were affected by some symptom or other. And the black lines here are the healthy cats, and the red background here are the IC cats. And so you see, we did stress studies, and there was new dogs, and unfortunately the ceiling drained from up above, and you notice this bothered the control cats more than the healthy cats. And then Judy decided to take a week off in the summer. And so, sure, you're welcome to go. And the cats didn't like that too much. And then there's a variety of things you can see here, just environmental stimuli. This was a study that we did that would take a long time to explain, but anyway. And then she went away again after another year, and you can see by now the cats really didn't like it. And as soon as she came back, they got better. So anyway, those are the kinds of things that we saw, that she saw and recorded, and we published over time. So we had a pretty good idea that the stress response system was sensitized. We thought sensitized, or at least sensitive, in these IC cats to a greater extent than it was in the control cats. But you still see the same thing in controls, and certainly people without chronic overlapping pain conditions can get stressed and not feel good. So that was what happened in the colony. This was a study that we did with client-owned cats. And so this was says there, prospective, double-blind, placebo-controlled study of more than 100 cats with IC that was done at 4 veterinary universities in the United States, including Ohio State. And so the x-axis here again is time, it's 6 months, and this the y-axis is total lower urinary tract symptom score. So urinating outside the litter box, blood in the urine, frequency, urgency, those kinds of things that the owners observed. And you notice a few things about this. First of all, it's sort of like the and this was actually faster. Within about 2 months, these all of the cats had symptoms scores had dropped by about 75%, and then sort of like the cats in the colony, they kind of percolated along here. This was 4 doses of Elmeron that were given to the clients as treatment A, B, C, or D. And it was a liquid. And what they would do was that they would put it on twice a day. They would put it on a tasty treat, a piece of very tasty wet food, and call the cat over and give the cat the treat and pat it on the head and tell it to have a nice day. And then they would do the same thing in the afternoon. So that was the treatment. And you see that all 4 doses of Elmeron had the same effect, the same positive effect. The thing is, the black line there that you see across here, that was just a vehicle. There was no Elmeron in that treatment. So cats respond to placebo just like everybody else does. And probably had more to do with changing. We speculate that the change had more to do with the owner interaction with the cat than the cat's interaction with the drug. And this was so the drug and so the doses were broad. They were 0, 75, 300, and 600 milligrams a day if you were a person. Certainly much less for a cat, but. So that was interesting. We also had some secondary outcomes that you can pretty much read here. We still had flares, as I talked about, which we see in the colony for the cats, even when they seem to be doing well, but both based on the client's report and on cystoscopy. 2/3 of those cats were moderately to highly improved. And the clients were very happy about it, regardless of the treatment that the cat had gotten, whether it was the vehicle or one of the doses of Elmeron. The sponsors of the study were so impressed with those results that they blocked its publication for 7 years. And so it was only ever published in 2009. These studies were done between 1997 and 1999, and they were only published in abstract form in 2009. But in 2014, 2015, similar studies were published in people, to the point that Johnson & Johnson abandoned the study because they couldn't find any effect in 2014. And now, of course, there's some concern about the possibility of eye damage in some people with prolonged use, and that's still being looked into. I don't know, but anyway. So we don't use Elmeron in cats. What else? Oh yeah, The if you read papers about any of these chronic overlapping pain conditions, in the first paragraph of almost all of them, whether it's IC or fibromyalgia or irritable bowel or any of the others, somewhere in the first in the first paragraph, it's going to say causes remain unknown, which I think, which bothers me because it sounds hopeless, and it's not necessary. Just for example, citrus, orange, lemons, limes, those kinds of things were known to prevent scurvy for at least 500 years before the cause of scurvy, which was the absence of ascorbic acid or vitamin C, was discovered in the early 1900s. So you don't have to know the cause to be able to do something. And because of that, I like this is a model that it's been around for a long time too. And for lack of a better term, it's called the 4P model, which in the present context is kind of ironic. But anyway, it's a factor-based model. And so the factors that it looks at are predisposing, things that happen before the disease occurs that might make it more or less likely, precipitating, things that happen around the time the disease occurs, perpetuating, things that keep the disease going, and protective are things that enhance the probability of recovery. And so just some examples this from IC, but if you look across the chronic overlapping pain conditions, you see the same kinds of things. Genetic factors have been looked at in people. Persian cats are more likely than Siamese. IC tends to run in families for a whole variety of reasons that we don't have time to talk about. Some temperaments might affect it. In cats, for example, it tends to be the more cautious or reserved cats that have IC, but sometimes bold cats get it too, which was a surprise when we first learned that. And then early life events sensitize the threat response system, and I talked about that because that's what we found. That's what we found in cats, but there certainly is a literature on in humans as well, that early life events and it could be anything, a death in the family when the child is very young of someone else, unstable environment, moving around in different places, just anything that's and we don't. Everybody's threat response system is tuned differently to their environment, so it's really hard to predict what it might be. Precipitating cause or any event, injury, infection, abuse, all those kinds of things that people talk about. If they're enough of a survival threat to lead to chronic activation of the threat response system, they can precipitate it. And they can perpetuate it. So something completely different from the precipitating cause could be perpetuating the disease. And this is where we get back to things like conflict and invalidation and exclusion, the loneliness, those kinds of things. And protective factors, it turns out, are just pretty much the opposite of the perpetuating factors. So that if you can find ways to address invalidation or exclusion or conflict, and people tend to get better. And which I think is what happened in cats, is that Judy was just able to make those cats feel safe, and certainly her timing was predictable, and she let them choose everything they could. Just a trivial example of that, I think I'm okay for time, is that one of the things Judy taught me was that when cats tear up their cage, because sometimes the cats will have a shelter in it and they'll have food and water, maybe a couple of toys, and sometimes you'll come in to clean cages and it's just been completely torn apart. And I was used to clean the cage, put stuff back in, wander off, go do something else. And what Judy says is, no, you don't do that. What you do is you put things back exactly where the cat put them. And when you do that, they don't tear the cage up anymore. So they definitely have preference. And she learned that, she learned very quickly to let them choose as much as they could. So they could choose during playtime in the afternoon. If they didn't want to come out of their cage, they didn't have to. Some days they did, some days they didn't. So choice is crucial. So what did we do for cats? Well, this is the list. These are the principles of the way we treat this disease, the way we treat IC in cats. And I would say that this is the standard of practice in veterinary medicine throughout the world now. And it is a combination of these 4 factors. First, we try to educate clients on just how cats are, and they're just a little different from some other species, and try to explain how they are. For example, cats are an independent species as opposed to an ultrasocial species like we are, which means that they can get along with other cats. But in nature and during evolution, they pretty much came together just for mating and maternal care. And so if you get, and you can keep more than one cat in your house with you, but you have to have what's called a house of plenty, which means that every cat has its own set of resources. It's got its own litter box, it's got its own food and water bowl, it's got its own toys out of sight of the other cats, plus one. So that's a lot of resource management for owners. But what happens is that the cats aren't going to fight over resources because there's just too many to worry about for them to have anything to fight about. But as soon as you start limiting resources, they start to fight. And they get hurt or they get sick from that. So safety is the other thing. Most of the almost all the cats we studied were indoor house cats, so they were confined, so that was pretty close to the colony. And so some people would say, well, why don't you just let them outdoors? And you can, but there's also dangers outdoors. There's other cats outdoors in crowded space. There's busy road traffic, those kinds of things. And there's large predators that sometimes will attack cats, and dogs and people, the coyotes, those kinds of things. So we had to develop safety. Predictability means that you try to feed at the same time of day. If people's schedules are erratic in homes, try to set up rituals so that the cat knows when you're leaving, that you're coming back, by telling them, by playing with the cat or loving on them for a few minutes before you leave, and then when you come home, so they get used to the idea that you're coming back. And then choice, if you change the food or the litter, for example, in a cat, is always changed by providing it food, for example, at mealtime in a separate container right next to their usual food, so the cat can decide whether they want it. And for anybody who has cats, if you change litter and do it that way, and they don't like the old litter, they will go to the new box and never go back to the old one. So they clearly have preferences, and if you give them something they like, they'll use it, and it'll reduce their stress response system. So that's how it works in cats. But as I said, cats are an independent species. Humans are an ultra-social species. So education is what I'm trying to do today a little bit. Safety is important. We'll talk about that just a little more, but we also need to stick social connection in. And if you haven't seen it, this picture here is of the US Surgeon General's recent report on the epidemic of loneliness in the United States, and how important it is for us to establish social connections and community. And this it's easy to find on the web, and there are recommendations in there for everybody from government to researchers to healthcare givers to family and social group members to individuals on how to improve social connection and the benefit that it'll have for all of us for our health. And since we've all been through COVID in the last 3 years, everybody's got an idea of what that can feel like now that I don't think we had the same appreciation for. And then predictability and choice are just as important for people as they are for any other animal that's not based on cats. So let's see here, almost through. So the problem with that report is it's going to take a generation at least for that to get into standard medical practice, and we need to do something now. So if so my recommendations to a family member, if they came to me, would be these. If you're the individual, find someone to help you. You know, if it's your crazy old veterinary scientist uncle, that's fine. But if you don't have one of those, find somebody in person or online if you have to. And if you're not, and someone comes to you with a problem like this, tell them that you love them, believe them, trust them, and you'll help them. Because that's what they're looking for. They're not looking for competence as much as they are warmth, and that's actually been studied. So anyway, and then I would help that person surround themselves with support. And what I mean by that is positive, hopeful support for people trying to scaffold them back into society. There are lots of support groups for these chronic overlapping pain conditions, and some of them are positive and supportive, and some of them aren't. And those can be dangerous, because if one focuses just on the distress or the interference with life, and not to avoid it, but to acknowledge it and then try to move beyond it, that may not work so well. Particularly for chronic pelvic pain, as you know, there's issues often with intimacy. And I certainly have no expertise to discuss that with anyone. Excuse me. But I would say that if that's an issue that you know someone who's having a problem with, and with, if you don't have other support, you could look on the internet for National Public Radio. Just type in NPR and kink, because there was a broadcast on NPR 4 or 5 years ago about what the kinky sex community, how that works, which I had no idea about. But what's so interesting about it is that they are all about permission. And for some of us, maybe the old ones of us, there was sort of permission to have sex, and that was the end of it. And maybe not a lot of discussion after that. But with kink, it's sort of like cooking. And if you're making dinner with somebody, you know, you might ask them, well, do you want vegetarian, or do you want something a little meatier, or do you want spicy, or a little more salty or sweet, or something like that? And then as you're going through cooking and doing the different processes, you're asking, how do you like this, and how is this for you, and is it are you going to get what you want, so that you're sure that the other person, as well as you, are satisfied at the end. And there's a lot of ways to do that without what is generally thought of as intramission sex. So those are other things to think about. And there's some really good advice that's available for those kinds of things now. And the other thing I think I would try to help the person understand is that it took the cat 6 months. We don't know how long. Some of the cats, it took 2 weeks. Some of them still struggle because of differences in severity of the disease. But in my experience with IC people, they're driven, focused, hardworking people, like athletes. And like athletes, when you have an injury, you just want to get back at it as quick as you can, and you can re-injure yourself. And so one of the challenges in why having a coach, a helper with you along the way, is that they can let you know if maybe you're pushing a little too hard, and it might be worthwhile to back off just a little bit and accept that you didn't get into this overnight, and you're not likely to get out of it overnight. But I'm going to be here to help you the whole way. So how's this work? Well, I had a misspent youth as a nutritionist, and so I like nutrition analogies. And so what we did with the cats here was we would first play the waiter, and we would provide a menu of options, just like if you went to a fine restaurant and the waiter came out and gave you the menu, and you might say, "What's good?" and they would say, well, I don't know what your preferences are, but the fish is good. And you might say, oh, I don't like fish. And so, well, then you might like something else. And so they will make suggestions, but you're never going to go to a restaurant where the waiter comes out and says, you will eat this tonight. Because even if it's what you'd have chosen, if they made you eat it, you wouldn't like it probably, or at least I wouldn't. So anyway, and then just like a multiple course meal, just pick one thing. People that are hardworking, like athletes and some IC patients, they won't do everything all at once, and that's not pacing yourself. So pick one thing and then try it, because what happens in a restaurant is that once the waiter gets the order and goes back into the kitchen, the cook has a very specific set of recommendations, a specific set of steps that they do to make sure that it works, that the dish comes out right every time. Okay. Excuse me. And that's going to take time to learn. And maybe what works really well for you is not going to work well for somebody else. And it's going to take practice to find out. So the first thing that you try might not be to your liking. And so you might need to try a couple others. And then once you find something that you like, it's sticking with it for the rest of your life. And in that way, it's sort of like brushing your teeth and bathing. It's not something you can do once and you're through with it. You have to do it over and over again and make it a part of your routine. And that can take time too. And that's another reason for not trying to start off on too many things too fast, because then it gets overwhelming and you re-injure yourself. One can re-injure themselves. So my hope for you is just this, it's just hope. Because of all the dimensions, there are some people who have really severe IC, I know that. And I don't think anybody knows what to do with them. But I think loving, trusting, and believing them would help. And I very well know that IC and all chronic pain sucks. We need to be social. And so I think what I would say to you is how far can we get together? I'm sure that you've got ideas about enhancing social connection and getting and working with other people that I wouldn't think of. And if you do, please put them in the chat and we can talk about them. Because nobody's going to figure this out on their own. And it's going to take a whole long time before it just comes, through medicine to us. So until it does, this is what it seems to me, this is what we got. And finally, Dr. Centuri, and I'm going to read this so I get it right. Renee Hessler and I are developing and testing a group-based educational support program. So just based on all of the principles that we've spent our time talking about, to help people with IC and other chronic overlapping pain conditions recover from the impacts of chronic pain. We're hoping to share more information about this program with you in the next 6 months. So stay tuned for that. And there unfortunately isn't much study of social factors in IC specifically. And so this is UC Davis IRB language. Because since I couldn't find evidence, I created a study of my own that's fairly short. There's some questions about your symptoms and some questions about your social life that I took from validated questionnaires from other places. And so there's a QR code if you want to scan it. And I think there's there should be a link in the chat to that you can just click on it. It'll take you right to the survey. And if you wouldn't mind filling that out, it's when you're trying to apply for grants or trying to convince people of things, having data helps. And so having these data, however they come out, will be helpful. And so just before we go, I'll leave you in the next slide with some resources, but I thought I would just leave you with a picture of the colony. And this is what playtime in the afternoon looked like. And the cat's cages were on the side there. Judy played music for the cats. She found out that they like classical music, but they did not like hard rock or country, and for whatever that's worth. And you can see that they had the toys out, and she would just and the cats. I mean, they're not all in a group playing with something. They're all looking around for themselves. And so while they were doing that, she was making observations of all of this. So here are some resources. They're also in the notes, which there should be a link to in the chat. And there's lots of resources. These are just some that I know about and think might be helpful to some of you in different contexts, possibly. And if you know of other resources that you really like, put them in the chat either, because I think this is an opportunity for us to work together to try to help each other. So thank you very much. And let me stop sharing screen. I'll come back, and if people have questions, I will try to respond to them. Let's see, looks a couple of things in the chat. Oh, good. The notes are in the chat, and link to the survey is in the chat. Perfect. Questions, comments, ideas? Sorry, I didn't leave you much time. Well, don't everybody
Tony,
talk
I'm
at
going to ask a
once.
question.
Sure.
No, I just want you to, I wanted you to go back to something that you talked about, because you were towards the beginning of the presentation, you were talking about some of the things that you saw in the bladder lining of cats. And I know for me, when I was first diagnosed, I was told, hey, it's because you have this deficiency in your bladder lining, and that is the root cause of the symptoms you're experiencing. And I think what you're saying, and if you can speak just a little bit more, or make sure I'm saying this correctly, what you're saying is there could be some changes in the bladder lining, but there is a possibility that our body's stress response system might be causal or lead to those changes, and not necessarily that it is, okay, we have this defect in our bladder lining that then causes the symptoms. Am I saying that correctly?
Yes. And I guess what got us off on that is an excellent question. And that was that if that was the case, if there was a primary defect in the bladder that was the cause of everything, and I would say that no study has ever demonstrated it's a cause. They've only demonstrated association. So that's a little concerning. Then it was really hard to understand how the bladder would know that we changed the external environment enough to heal itself without being connected to the threat response system, which it is for anybody. And I was just thinking about that this morning. For anyone who's ever given a talk that needed to pee right before they went on, I mean, the stress response system is clearly connected to the bladder. And so I think I personally, I don't mean this to be disrespectful, I think it was confusing association with causation.
Yeah.
But because the bladder clearly is involved, and it clearly is, and it clearly has the microscopic damage to the urothelium and glomerulations and enhanced permeability and all that kind of stuff. The question is, why? And it was just assumed to be the cause.
And I think this is such an interesting point, because for me, when I learned about the potential role of the stress response system, it opened up so many more doors for treatment strategies. Because right now, the treatments for our bladder, based on the literature and the science, like you said, they may work for some, but there's none that work in the majority of people. But I know how to calm my stress response system. Like, there's this whole array of treatment options that I can use to help calm my nervous system. So for me, this was a really important thing to learn, and has been really instrumental in my own healing journey. So I just add my own 2 cents there.
Well, and I would say, based on what I know about you, you have a pretty good social network too.
It helps a lot.
For all of us, yeah. Yeah. Oh, well,
I have
Please.
Hunter's ulcer, and they were saying that food has so much to do with it, but maybe it's really stress, and I need to take 10 vacations.
Well, that would be worth a try. see how it helps. But I would go to places that you want to go to, that you choose. Yeah.
Yes, but food wasn't necessarily the big problem in cats.
No. And when it's been studied carefully in people, there are questions about how much the ingredients or chemicals or nutrients in food have to do with it, as opposed to the way we think about food and the meaning that food has in our lives. Because when people have done blinded studies to test to see if particular foodstuffs like spicy things and stuff doesn't work. But if you tell people that spicy foods are really bad for you, and then come back 5 years later and say, do you avoid spicy foods? They're going to say, well, yeah, you told me to. So it's that's a whole nother lecture.
Thank you, because I was told I shouldn't have alcohol, so I haven't for 7 years. Not that I ever need it, but I went home and had a couple of vodka tonics and nothing happened.
No. And well, and in fact, I was talking to an IC patient one time, and she said that one of her food flares was champagne.
Yes.
And I thought, that's kind of strange. That's not something that, that's not something people consume on a regular basis. And I said, well, tell me about that. And she said, well, the only time I ever have champagne is when I go away for the weekend with my husband for our wedding anniversary. And so you don't think anything else is going on during that weekend that might explain that?
Thank you so much.
You're welcome. You're welcome. Yeah. Well, if there are no other questions, are there other questions?
Any more?
Huh? No? Okay.
Well, I would like to thank you so much for being here with us today, Dr. Buffington. Today's session was very informative. If you found this event to be of value, please consider joining us for future webinars and invite your community to join us. We're also excited to announce next month's webinar with Jennifer Ferriello Moldwin. She will be presenting When Sex Hurts. So you can watch your email for more information. And we thank you so much for joining us today. Have a good one.
Bye-bye, everybody. Happy solstice.
Yeah. Thank you, Tony.
Thank you.
Okay, bye.